The Fox 31 Problem Solver is helping you stay on top of your health during the coronavirus pandemic, which is something I think we all want to do right now.
Yeah, and it can be tough in these times to get your regular checkup and make it to all of your appointments during all of this. We have Dr. Kenneth Cohen. He is the Chief Medical Officer at New West Physicians in Arvada. He's joining us live via Skype this morning with some tips. So, Doc, first, are you hearing from patients that are reluctant to come into the doctor for routine care during this COVID-19 pandemic?
Absolutely. We've been teaching our patients to be very careful in terms of social distancing and protecting themselves. And then we're asking them to come into the office. So it creates a national caution. Absolutely.
Well, and let's talk about that. I mean, some people might be putting off some of that routine care. That's always a concern. Are there times, though, when it's okay for people to maybe wait a couple of months and times when they shouldn't?
You know, if they're perfectly healthy and they're just deferring a routine physical, I think that that's fine.
Yeah.
But when there are chronic illnesses like hypertension or diabetes or heart disease or lung disease, those folks need regular monitoring so that we can adjust medications and make certain that they're doing optimally well. So there are times when it's safe and other times when it is important to get in for your visits.
And how do you make the differentiation between what is imperative and needs critical care now and what can wait? And more questions when it comes to children. Do the rules change when it comes to children making pediatric appointments?
The biggest concern with kids is that we have already seen a 43% drop off on immunization rates compared to the same time a year ago.
Oh, wow.
So that's a very significant concern. And we have created ways that we can safely administer vaccines to kids. And these vaccines are very complicated. And if you miss some vaccines, sometimes it'll throw off the whole schedule and you need to start over. So it's important not to defer those vaccinations. In terms of who should come in and who doesn't need to come in, contact your provider. We have shifted to televideo visits. And for all of those visits where it isn't essential to have a face-to-face visit, we can do those through a televideo visit. And our patients have been delighted with that approach.
Well, I feel like that's kind of the message that I've heard from a lot of doctors as well is, there's lots of information out there, lots of resources, and don't hesitate to call the office because that's what they're there for, right? To answer the phones, to answer your questions, to make you feel good, or help you make that decision about whether or not to come in.
Absolutely. And if you do need to come in, it's important to recognize that we can conduct those visits safely. We screen all of our patients for any COVID symptoms. We check their temperature before they come into the office. And if somebody does have COVID symptoms, we see them in specialized clinics where all of the protective gear is in place and we can safely care for those. But in doing so, we've been able to keep all of the other clinics sterile. And the patients are masked, our staff is masked. We clean those offices extensively between visits. Our providers are using gloves. So we can very, very safely care for people during this pandemic within an office setting, and that's important to recognize.
Well, Dr. Cohen, thank you so much for giving us some peace of mind. A lot of people, reluctant and trying to get back to normal, but thank you for clearing some of those questions up.
Yeah, no question. Just some directive, I think, is always
Yeah.
good. 9:25 on your Friday morning now.